Good evening. I'm Dr. Lata Bhat. I'm a neonatologist and I take care of the developmental problems of children. So today I want to talk a bit about the preterm babies who are born before 36 weeks. Normal babies are born from 37 to 40 weeks, okay, of gestation after the mother becomes pregnant, and babies who are born before 36 weeks have some problems. Babies who are born from 34 to 36 do not have that much problem, but those who are born below 34 weeks and especially those who are born below 28 weeks have a lot of problems. So, and especially babies who are less than 1.5 kg or less than 1 kg. But in good centers in India, and especially in my own center also, we do save babies about 600, 700, 800 gram babies, and also those born about 25 to 26 weeks of gestation also we are saving, and I have saved about 90% success rate has been there. Now globally about 15 million babies are born preterm, and out of this 25% are born in India. So imagine the burden of preterm babies in India, and the facilities which exist in India are abysmal as compared to the number of babies who are born preterm. And we have to remember that out of all the number of deliveries, about 12.5% are born preterm, which is a huge number. About 27 million babies are born annually, and out of which 3.6 million babies are born preterm. So now, considering the problem, all the prospective parents and everybody should know what causes prematurity. Okay, because however much educated a gynecologist may be or a pediatrician may be, there is no foolproof method to predict and prevent it, but there are certain factors which contribute more to prematurity. So early recognition and timely transfer to a higher center with facilities is very important. Now in India it happens due to complex factors, so it happens in poor people as well as in rich people. Now pregnancy in adolescent people who are not yet, whose womb is not yet ready to take babies, or if mother is underweight, there are recurrent infections in the mother, undernutrition, then substance abuse in the mother, improper nutrition, in vitro fertilization, if the mother has diabetes during pregnancy, mother has uncontrolled blood pressure during pregnancy, infections during pregnancy, especially urinary tract infection or genital infection, sexually transmitted diseases. These are the conditions where we can definitely predict that baby can be born preterm, and also multiple pregnancies. Especially if the mother has twins or triplets, then there is a risk of preterm birth is more. Now, stress also leads to preterm birth. In the current lifestyle, there is stress. Everybody is career oriented. So there are we are facing a lot of infertility. People are taking treatment for infertility, having in vitro fertilization. That is also leading to preterm birth. Now, once we know that there are a lot of factors, how do we prevent it? First is prevention, and then comes treatment. For prevention, as I told you, before conception, we have to think that mother's nutrition should be good, she should be well nourished, mother's age should be appropriate, she should not be a teenager or an adolescent, at least more than 22, 23 years of age. Then pregnancy planning, birth spacing, then we have to think of preventing sexually transmitted diseases. We have to give vaccines which are recommended currently for adolescents. Then genetic counseling, screening for diabetes. If there is substance abuse, we have to stop it, stop smoking, and prevent stress and all these things. And proper antenatal care by a proper gynecologist, where they screen for all the things and do regular ultrasound examinations, mother's examination, and they train the mothers to handle the pregnancy well. Now, despite doing everything, if we are not able to avoid preterm labor, then one has to plan to deliver in a center where there are facilities. There is a trained newborn consultant who will be attending the delivery, and they have all the facilities to take care of the baby after birth. And supposing if still the baby is born suddenly in a center where there are no facilities, then a proper transport should be arranged. We should not just pick up the baby and shift to a next center, because temperature maintenance is very important. You have to take care that baby is receiving continuous glucose, baby is receiving oxygen if required, and properly transported. Even during transport, if these things are not taken care of, the baby's brain development can be affected. If transient dip of oxygen for even few seconds, few minutes, if the baby is not receiving any glucose and blood sugar drops, or if there is very vigorous transport, there can be there can be hemorrhage in the brain. So a newborn baby, especially preterm baby, is very, very delicate. The transport should be done in a very proper manner. And then once you have gone to a center where they are saving babies, you have to first maintain the temperature, take care of the breathing, if required breathing support, if required oxygen, then jaundice, maintenance of blood sugar, prevention of infections, then regular screening to look for the eye problems or brain problems. And once the baby survives at the time of discharge, these babies may stay in a hospital for a long time. And after discharge, you should listen carefully to what the doctor is telling, because a proper follow-up is what will give a quality of outcome in the long run. Okay? Because we just don't want to save lives and give them long-term problems like hearing, speech, vision, or any physical disability. All these are preventable and to a certain extent correctable if you follow properly with a pediatrician, and if possible with a developmental pediatrician. So that's very, very important. So my take-home message is, try to prevent preterm birth by knowing the factors which cause it, and if it's inevitable, get your delivery done in a center which has facilities to take care of the preterm babies. And after the baby survives, follow up all the instructions given by your doctor and follow up with a developmental pediatrician. So if you have any further doubts related to a preterm baby or any other baby, you can consult me through librate.com, where we can chat, or telephonic conversation can be done, or you can contact me in Palak Child Development Clinic, which is in Purvanchal Plaza, shop number 106, Mayur Vihar, phase 2. Thank you for all your attention.